Let's go to our West of England correspondent Rebecca Wiliams now, who's with a home help service in Bristol, which was one of the ones which came out favourably in the review. So, Becky, good practice where you are, but not so in many parts of the country.
No, that's right, Jonathan. We are shadowing them today, so we will go house to house, and the idea is we go throughout the morning, so stay with us. But of course, this has been, by the CQC, one of the biggest surveys that they have ever done. 24,000 healthcare providers involved in this, and of course the startling finding that 1 in 4 are insufficiently safe, and the types of problems we are seeing are issues with call bells, so patients not being responded to properly, things like patients not being cleaned and clothed overnight, and then healthcare providers that go door to door, so to people's homes, they're not getting enough time spent with those needing it. So there are a number of issues. Now, as you mentioned there, this service here is rated good. Let's go inside now and have a chat to the lady who owns it, Judith Swindles, because she can tell us a bit more about this. And Judith, this report today, pretty damning. Why do you think it's had that response?
I think that over time, social care hasn't invested enough in its leadership and in management, and I think in any sector we know that leadership and management is very important in ensuring that there are safe procedures in place, there are effective policies, but not only that these policies and procedures need monitoring as well, and that definitely is something that I think has been lacking in social care. We at Premier Homecare try very hard to make sure we do have procedures, and we definitely monitor those procedures as well, and the fact that they're being followed. But it's definitely something we see on a daily basis, people coming, talking about these issues as well.
And of course, over the last few months, some have said that there is a healthcare crisis. What needs to be done?
Oh, lots probably. I think money is an issue, resources are an issue, but not just throwing money at any old thing. I think the money needs to be carefully considered, and also that money needs to be invested in making sure that there is strong leadership and management. Certainly, as I say, it's about monitoring the things that you put in place, because anybody can say we've got this procedure and we've got that procedure, but it's about making sure that it's followed. If it doesn't work, that things are improved.
Thank you very much. Appreciate your time. So, as I say, we are going door to door now. The idea is that we go throughout the community here in Bristol. So stay with us throughout sunrise, because we will get opinions from not only patients but also carers along the way.
Many thanks, Rebecca. We'll catch up with you a little bit later. Well, let's go to our West of England correspondent now, Rebecca Wiliams, who's with a home help service in Bristol. She's been there all morning. It was one of those which came out favourably in the review. Good morning to you, Rebecca. You've been there for a few hours now. Good practice where you are, but that's not the case everywhere in the country, is it?
No, it's not. This is our first call of the day. We are here in Bristol and we are shadowing them throughout the day to see what they get up to. But as you say, this report is huge. In fact, it's the biggest the Care Quality Commission has ever done. It includes 24,000 healthcare providers, and it's found that 1 in 4 are actually unnecessarily unsafe. So things that they are experiencing, people are that elderly people are not able to use their call bells in places like nursing homes. They're not being changed by overnight staff, and there's also been an issue with staff training. But like you said there, this service has been rated good. This is a home care service. Let's speak now to one of the ladies who's a carer here. First of all, you, Claire.
Yes.
Just talk me through, what kind of pressures are you under?
Sometimes there's time pressures, but it's not too bad, because what we do with Premier Home Care is that we go to calls with plans. So we have a care plan before we go to the call, and we know exactly what we're going to be doing and a little bit about the client's background. Time pressures can be hard if you do council calls, because you're limited to the amount of times that you can be with the client, which is hard when somebody's older and they obviously are a bit slower and they need that support and help. But a lot of the clients that we go to, like Marielle, are lovely, and we find out a bit about their background to help them so that we can make their life a bit easier. And
it must be very rewarding. Let's have a chat to Marielle, if you're happy with that, Marielle. How important is this service for you?
Well, very important. I was in hospital, And they said, what are you going to do when you get home? You better have some help. I hadn't thought of that before. But of course now, I'm very glad of it.
And do you get worried about, you know, the cost of getting older, what will happen, you know, in the future?
Sometimes, but you might be very temporary and it might never happen. It's no good worrying about it, really, because something will look after you.
Thank you very much. Thanks for speaking to us, Mariel. Well, there you see, Mariel is the first client, as I said, of the day, and we are going across Bristol today to see their different services. They spend about an hour with each client and then on to the next one. So stay with us throughout Sunrise where we go on to the next one.
We will. Thank you very much, Rebecca. Well, let's join our West of England correspondent, Rebecca Wiliams, now. She's been on her rounds all morning with a home help service in Bristol. It was one of the ones which came out favourably in this review. Morning, Rebecca. So the staff that you're with have been praised, but it's not the case everywhere in the country, is it?
No, it's not. All through the day, we have been going house to house. This is the second call out of the day. In fact, Sharon is just, you're about to go into the house here, aren't you? So we've got a lady in this one, and join us throughout Sunrise, of course, because we are going door to door. But as you say, this service has been rated good, but this Care Quality Commission is the biggest that we have ever seen. 24,000 healthcare providers have been surveyed, and it found that 1 in 4 are actually unsafe. And the issues that we are seeing are things like residents in nursing homes aren't being responded to in terms of when they use their call bells, the level of training. There are issues with that, and also the oversight of medication. And in home-to-home visits, they are saying that there isn't enough time spent on those. But like I say, I'm here with Premier Healthcare, which has been rated good. Let's speak to the owner of the company now, Judith Swindles. And Judith, why do you think that this report has come out to have so many issues found?
I think for a long time, the social care industry hasn't had the investment in management and leadership that it so needs. All too often, there are desperate vacancies of senior posts, and whoever seems feasible is put into one. Whereas actually, people need to be managed and they need to be led in order to put proper procedures into place. But really, really importantly, not just having those procedures in place, for example, medication procedures, but actually monitoring that they're followed and if they're working, and then making sure that they're improved if they're not. It's very important to monitor those things as well.
And do you think that this so-called awful term, bed blocking, is putting pressure on social care? Absolutely,
because with bed blocking, there aren't enough doctors, there aren't enough nurses, so nurses are being required possibly to do some of the things that doctors are doing. Because they're doing that, then social care professionals, home care people, are being asked to do things that maybe at one time district nurses would have done. I used to be a nurse and I saw myself doing things that now home care people are doing, but not necessarily with the funding to train people commensurate with the level of work that they're required to do, with more complex care packages being in the community these days.
OK, Judith, thanks so much. Well, following this big report, this big survey, AGK has come out and said that Russian roulette is being played with people's health. Although, on the whole, the Care Quality Commission said that it did pass the mum test in terms of whether you would put your own family into these sort of establishments. They said there are serious issues.
Rebecca, thank you very much.